Hi, this is Dr. Wells from Wells Medicine, and I wanted to talk about one of our more unique treatments, nitrous oxide. Nitrous oxide is an NMDA receptor antagonist, just like ketamine, and we find that it's most helpful for patients with treatment-resistant depression and anxiety. These are pretty rare across the nation for the treatment of treatment-resistant depression, although they have been studied for more than a decade now. We have still just, a handful of papers, 15 papers discussing the methods of how nitrous oxide works, the results from clinical studies on nitrous oxide, and the data seem to be as effective or more effective than ketamine for the treatment of treatment-resistant depression. And that's how we've been using it at Wells Medicine for about the last 8 years. A lot of patients will come and tell us that they discovered nitrous oxide by going to the dentist's office or having a minor surgical procedure, and they felt so much relief afterwards that when they investigated what the cause of that relief was, they had been given nitrous oxide during their procedure. Nitrous oxide is an NMDA receptor antagonist, just like ketamine. It does create a journey space, just like ketamine. It has slightly different, for lack of a medical word, vibe to it. Whereas ketamine's journey is often very much a slideshow or very visual and very spacious. Nitrous oxide is generally described as more floaty, more of a dreamlike state. But the other big difference is that with ketamine, our usual clinical protocol that is done in all the studies with ketamine is 6 treatments and then moving to monthly maintenance. The nitrous oxide protocols are either monthly maintenance from the beginning or twice and then monthly maintenance. So for patients for whom they need to be able to drive themselves home, or they don't have any IV access, or gaining IV access is a traumatic situation or a reminder of a traumatic situation for them, or for patients who really don't like the idea of a journey that they can't get off very quickly. Even though IV ketamine does resolve fairly quickly, nitrous oxide resolves within 2 or 3 breaths if you want the journey to end. So for those reasons, there are some patients that are great for nitrous oxide versus a ketamine treatment. To summarize, there are some patients that do better with an NMDA receptor that they can recover from very quickly. They can drive themselves home. They don't need IV access. It's a little bit of a lighter journey, and they can recover very quickly, even in the middle of the journey, by simply removing the mask and taking 2 or 3 big, refreshing breaths. And that's nitrous oxide.